Welcome to the ACLU of Washington's Virtual Flights and Rights. Our moderator is Michele Storm, Executive Director of the ACLU of Washington. Once we enter into the moderated discussion portion of the program, you may type in question at any time in the Q&A section on the top bottom left side of your screen. For those on phone only, please check your email for instructions on how to submit questions. Michele, you may begin. Thank you.
Good evening, everybody. Thank you for joining us for the next hour. My name is Michele Storms. My pronouns are she, her, and I'm the Executive Director at the ACLU of Washington. I'm very pleased to welcome you to our second virtual Flights and Rights. Now, in normal times, we hold these events in breweries and event spaces around the state, and most often in the gathering space of KEXP, that's 90.3 FM in Seattle, or KEXP.org everywhere else in the world. We thank KEXP for sharing music daily and reminding us that we're not alone, not ever, not even during this isolating time of COVID-19. When we gather in person, a local brewery pours the flights to go with our rights. We're so grateful for their generosity over the past few years and for many more to come. During this hiatus, please visit aclu-wa.org and click on tonight's event to see a list of the partner breweries, including those who are offering pickup and gift certificates right now. I invite you, if you're able, to support them. Those breweries have been supporting us at our events, and I know this is a tough time for small businesses, so if you're able, please give them your support. Small businesses are struggling, and the most vulnerable Americans are suffering. COVID-19's impact falls disproportionately on people of color, people experiencing poverty, people experiencing homelessness, immigrants, and people behind bars, and Indigenous people. We're learning that the virus is taking Black lives and Latinx lives in disproportionate numbers, not for any biological reason, but because of the institutional racism and systems of oppression that the ACLU works to dismantle every day. And in part due to these systems, we also find that many people in these groups are our essential frontline workers, farm workers, bus drivers, healthcare workers, restaurant workers, and so on. Also, we have 29 federally recognized Native tribes across Washington state. Tonight, the speakers and I join you from the occupied territory of the Coast Salish people. We remember that Indigenous people were lied to, treaties were broken, and their land was stolen. And we recognize this to honor our truth and our commitment to fight for justice for all. Acknowledgement is a critical and necessary step toward honoring Native communities and having a larger conversation on decolonization and reconciliation. We acknowledge this is not the first of life-threatening diseases that have been introduced to Native communities. Many of us are telling one another that we need to stay home to stay safe at a time when our unhoused community is more vulnerable than ever. And in a system where our Native neighbors are 10 times more likely to experience homelessness. At our last virtual Flights and Rights, I encouraged folks to give to the Chief Seattle Club, which is a local organization that provides a safe and sacred place to rest, revive, and nurture the spirit of urban Native people in need. If you're able, please support them. So many people need our help right now. Our website has a new page on how to get help and how to give help. We'll send around the link after tonight's talk. Since the start of the COVID-19 outbreak in Washington state, we've been strategizing at the ACLU around federal, state, and local responses to our current public health crisis. We don't do this work alone. In coordination with local allies, our national ACLU office, and ACLU affiliates across the country, we've taken actions to assure that responsive measures from the government follow public health experts' recommendations and protect the health, safety, and civil liberties of all. The ACLU has filed dozens of lawsuits related to coronavirus, including more than 20 against Immigration and Customs Enforcement, or ICE. There is hope. Here in Washington, our advocacy has prompted the release of hundreds of people being held behind bars for nonviolent offenses. You can learn more about our work related to the COVID-19 in jails, prisons, and immigration detention centers by watching our previous Flights and Rights that's now available on our website. Tonight, we're going to dive deeper into the work around privacy and technology in the time of coronavirus disease, as well as our advocacy to minimize the impact on young people facing juvenile detention, students with disabilities, and people experiencing homelessness. tonight I am joined by three of my brilliant colleagues. I'll tell you who all three of them are, and then each of them will give you a few remarks, and then we'll have our group discussion as we did before. So first, I welcome staff attorney Breanne Schuster. Breanne joined the ACLU Washington staff in 2015. She litigates a wide range of civil rights cases. Breanne has a BS in dance and Spanish from the University of Wisconsin-Madison and a Juris Doctor from the Seattle University School of Law. Prior to joining the ACLU, Breanne volunteered and worked at a number of local organizations, including the Society of Counsel Representing Accused Persons, the Washington Defender Association, Disability Rights Washington, and the Alliance for a Just Society. Breanne's job is to make our Constitution and laws mean more than just the piece of paper they're written on, and utilize these tools to fight for equity and liberation. Second, I'd like to introduce ACLU's Youth Policy Director, Kendrick Washington II. Kendrick joined the ACLU of Washington just last summer. Prior to his current role, he was a civil rights attorney with the United States Department of Education in the Office for Civil Rights and an adjunct professor at the Northwestern Pritzker School of Law. Kendrick began his legal career as a public defender in Boston and New York. Kendrick graduated from Northwestern University School of Law in 2010. Prior to law school, Kendrick was a sergeant in the United States Army and a veteran of Operations Enduring and Iraqi Freedom. Kendrick's job is to fight to keep young people in schools and out of prisons and jails. He works with policymakers and community members to replace punishment-based approaches with positive, preventative, and restorative approaches that can eliminate pipelines to mass incarceration. Last, but certainly not least, I'll introduce ACLU's Technology and Liberty Manager, Jennifer Lee. Jen joined the ACLU of Washington in January of 2019. She works on pushing for transparent and accountable technology policies that center community voices. She was previously a Google Policy Fellow, where she worked on issues regarding genetic data, algorithmic discrimination, and international privacy laws. Jennifer has a master's in public policy from the University of Cambridge and a bachelor's degree in international studies, public health, and sociology from Johns Hopkins University. Jennifer's job is to ensure that the explosion of technology in our society is fair, accountable, respects personal privacy, and advances our constitutional rights and freedoms. I'm really excited to have all three of them to present to you. They'll each share some information, and then all four of us will be in a conversation together. And you can jump in with questions at any time, as was described to you before, using the Q&A section on the bottom left side of your screen, and we'll try to get to as many of those as we can. So let's get started with Breanne.
Thank you so much, Michele, and thank you all for joining us this evening. I'm super humbled and excited that so many people are making space intentionally to be with us and learn about the work that we can all be doing together to address this crisis. I'm excited to be talking a bit today about the ACLU's work to address the housing crisis and the impact of COVID-19 on our houseless neighbors. But I also first want to acknowledge that we're just one small component of this huge body of work. Right? We have so many service providers trying to keep folks safe in our shelters, our healthcare systems and streets, people providing case management and health services, and trying to get people into housing and other alternatives. And we have Washingtonians throughout the state who are pulling together and showing up for one another in these unprecedented times, whether it's learning how to sew masks, donating and delivering food, medicine, or necessities to our neighbors, or sharing your time and money where it's possible to support those who need it. And for many, many years, people in poverty and experiencing homelessness have been organizing, warning us about the lack of affordable housing and the pitfalls of a broken shelter system, and advocating for a lot of the reforms and solutions that were being considered right now, like using vacant buildings and old hotels as temporary housing. I think this just really stresses the importance of listening to what those most directly impacted are doing and telling us, and that those voices are informing everything that we do. In terms of what the ACLU's work has kind of looked like in this field, and I think that both Jen and Kendrick probably share a similar perspective, but I don't want to speak for them. Like so many of the issues that we work on, our work has simultaneously, it feels like for me, like everything has changed and also like nothing has changed at the same time. Before the pandemic, right, we had this housing crisis because we had wages that were not keeping pace with housing costs. And now with COVID-19, we have wages that are obviously not increasing. And we're seeing more and more people lose their jobs. And we're not really seeing housing prices or rents decrease, right? So we're seeing COVID-19 exacerbating inequities and really shedding light on the fact that a lot of systems that we have in place currently aren't working or serving our communities. And these are systems that, long before the pandemic, we've been working to dismantle, and we're going to continue to long after COVID-19 is over. In terms of what the ACLU specifically is doing with the housing crisis and homelessness, I mean, in some ways, a lot of our work, or all of our work, actually touches on this issue, right? And I think Michele noted that before. We know that people experiencing homelessness are disproportionately people of color, LGBTQ youth, people with disabilities, those that have a conviction history. But in terms of this issue specifically, I kind of tend to think of our work in two buckets. And the first is sort of the more traditional work that we've been, traditional is maybe not the word that I'm looking for, but the bucket of work that has taken up a lot more of our focus and energy. And that's been reducing barriers and ensuring that we're protecting the rights of people who are experiencing homelessness and who are some of our most vulnerable neighbors. So when we're, thinking about this work, obviously it's important in the sense that, right, like we have this Constitution, it means something, everyone is protected by it. But it also is important that when we're thinking about these issues, that a lot of this work also does tie into preventing homelessness in the first place. And I'll kind of dive into like what that means, for example. So we've seen, throughout, and it's throughout history, this use of the criminal system to address social issues, and homelessness is no exception, right? We've seen that with our mental health system, for example, criminalizing behavior that is a product of somebody's inability to get, mental health treatment or services that they need. With regards to homelessness, we often see responses such as sweeping encampments, prohibiting people from camping or sharing food, from asking for money in the form of panhandling. And so we've been working on making sure that those things aren't happening, right? That we're not criminalizing people for things that they don't really have any control over. And the reason that that's so important is because we know that criminalization, when we're criminalizing people for conduct they can't control, that actually exacerbates homelessness, it exacerbates poverty. It makes it more difficult for people to escape their current situation, in addition to being patently unconstitutional. So in that sphere, we've done litigation, we've done work on briefs to support other people's litigation. We've been pulling together materials and resources for a toolkit that's available on our website, and we're working on updating that as well right now, and Know Your Rights materials. Working directly with community, doing policy advocacy and letters directly to municipalities and jurisdictions in Washington. And in the wake of COVID-19, we've also seen how important preventative measures are in addressing homelessness. And this is really an area where I really want to lift up the work that so many other allies and service providers and folks are doing. This is a space that we're getting more involved in, but is certainly always been really, really important. And when I'm talking about prevention in that bucket of work, I'm thinking about like, what are we doing to make sure that people that aren't currently experiencing homelessness or poverty don't become homeless, that we're keeping people in their homes. And so that bucket of work is kind of looking at, what is rent? What are rent increases looking like? What are people being evicted for? Preventing unlawful evictions and unfair landlord policies and practices. And providing support systems for people who might be otherwise struggling to get to maintain stable housing, like people that are survivors of domestic violence, for example. So I'm going to talk a little bit more in depth about what that has actually looked like in the wake of COVID-19 later, but I'll turn it over for the next speaker for now.
So hi, everyone. My name is Kendrick Washington. So first and foremost, while I'll be speaking about some of the work that we've undertaken in the youth policy realm, I need to reiterate that none of this work would be possible without the assistance, input, feedback, and even sometimes pushback and challenges from some of our many partner organizations. There's really nothing that we do alone in this fight. And I'm truly grateful for the teams that I've been able to work with. This has truly been a collaborative effort, and it's an effort that will continue to root in the needs of the community with equity centered in all that we do. So on the youth side of things, our response to COVID has been rapid and we've remained flexible. It began in earnest in mid to late March when we, along with 29 other organizations, sent demand letters to the Department of Children, Youth, and Families, as well as juvenile court administrators and presiding juvenile court judges regarding the release of youth in detention centers and the treatment that they needed while they were in. Our asks were pretty straightforward and we thought reasonable, but most importantly, they were rooted in public health guidance. So in short, what we asked for was that they release immediately the most medically vulnerable youth in their facilities. We asked them to reduce the population of currently incarcerated youth by using diversion and other strategies other than incarceration. We asked that they create transition plans to support youth who are released in order to ensure that they have safe and stable housing, repurpose probation away from issuing violations and towards providing assistance and support to keep people safe, and to change intake and admissions practices so that no new youth are incarcerated. When we're talking about youth inside the facility, we ask that they provide testing and treatment in a manner that meets or exceeds community-based standards of care. We ask that they provide incarcerated youth with unfettered access to soap and water, hand sanitizer, single-use towels, and that they implement social distancing measures without having to place youth in solitary confinement or locking their youth in their cells, for extended periods of time, and to increase telephone, email, and video access for incarcerated youth so that they can speak with their parents and their family. And also just to ensure that the detention centers were setting up distance learning or other educational opportunities for these youth. And finally, to ensure that they actually had updated information and that their families had updated information so that everyone knew what's been happening. So we sent those letters out. The response to our letters has been a bit of a mixed bag. We were contacted actually pretty quickly by the folks here in King County, and we were able to sit down and meet with them and to discuss what they've been able to do. And it should be noted that King County very quickly reduced their population by nearly 50%. And while we'd like it to be more, reducing the population is the best way to reduce the chances of breakout in the facility. With regards to the counties and the presiding judges, we received a letter saying that they were doing everything that they could, but it didn't really go much into detail. And it also declined our invitation to sit down and discuss further. What's happening from county to county is not necessarily clear, but we are hearing some positive things. Like, we are aware that, Cowlitz County has emptied their facilities, with the exception of 3 youth who are under immigration, customs, and enforcement holds. DCYFJR administrative folks, they really haven't responded to us. And so we're hoping to hear back from them so that we can sort of provide assistance to them and help sort of make sure that things are running smoothly there. And, recently I appeared at their oversight committee to sort of share what we're hoping to do, and we're hoping to bring them to the table here in the near future. On the education side of the house, which is sort of the other realm that I deal in, we joined in a joint effort with Disability Rights Washington and the Northwest Justice Project to reach out to the Office of Superintendent of Public Instruction, OSPI, and the Healthcare Authority to request that they work together along with school districts and contractors to, proactively ensure students with disabilities are not denied essential services that they have been accessing at school. For students with disabilities, school is sort of a crucial source of nursing, physical, occupational therapies, speech therapies, and social emotional learning therapies, and mental health therapies. And without school, these students often have no alternative resources for these sorts of critical services. So, the prolonged suspension of these sorts of services and instructional programming is going to have a far greater impact and longer lasting consequences for these students and countless others who really rely on schools to provide them with medically necessary skilled therapies, in addition to the education and socialization that all children need. Students who need these sorts of essential services cannot afford to lose these learning skills and behaviors that enable them to benefit from the instructional program guaranteed to all students under the Washington Constitution. And then finally, we are pushing and making asks, to ensure that even though the federal government is sort of offering an opportunity for school districts to move away from their requirements with students who suffer disabilities, that Washington schools continue to provide for students who need these services so that they don't get too far behind. And when we are finally able to ramp up and start school again, these students will be, as well served as other students who don't have special needs. So that's sort of a rough, brief overview of sort of the things that we've been working on. I'll be happy to answer questions more in depth later. But for now, I'm going to turn it over to Jennifer Lee.
Thank you so much, Kendrick and Breanne, for talking about such important issues of homelessness and youth. And thank you, everyone, for being here tonight with us. A key focus of the tech and liberty work we do at the ACLU of Washington is pushing forward community-centric technology policies on the state and local levels. And as our surveillance economy grows ever more robust, especially in the context of this pandemic, we're continuing to advocate for surveillance oversight and accountability measures that center the voices of communities that have been most historically impacted by surveillance. Key issues and legislation we've been working on and will continue to work on post-pandemic include facial recognition, data privacy, and AI-based automated decision systems. During this COVID-19 pandemic, we've been closely monitoring threats to privacy and civil liberties, and we recognize that even in the midst of this truly extraordinary circumstances, fundamental privacy rights and civil liberties can and must be protected. While COVID-19 is a grave public health risk and special measures to combat this disease are definitely warranted, we need to be thinking about a few key things in relation to privacy. And I'll just talk about 5 key things, but there are a lot of others, so happy to answer any questions afterwards. The first key thing is that privacy is absolutely compatible with public health. And in fact, privacy-friendly public health measures can often be more beneficial to public health goals over privacy-invasive tools that leak far more information about people than is actually necessary to perform the public health-related function of stemming the pandemic. Tools that collect personally identifiable data can be used to invade our privacy, deter our rights to free speech and association, and target and discriminate against certain groups or individuals. We've seen in countries like South Korea that have launched massive testing and contact tracing programs and where officials have anonymized and published people's location histories, it's led to some unintended consequences. Unfortunately, it's really difficult to truly anonymize location data. And a problem that has emerged is that many people have become more afraid of having their identities, their associations, and where they go, whether it's a love motel or a religious institution, revealed over having the virus itself. And folks being more afraid of stigma and social humiliation over the disease itself can interfere with testing, which is arguably the most important intervention to control the virus. Not only can privacy-invasive tools threaten our civil liberties, but they can also endanger public health by causing people to mistrust and abandon them when they're actually needed. The second key point is that surveillance tools are not a panacea to stemming the COVID-19 pandemic, and they should not replace or divert critical resources from testing and treatment. We're seeing an increase in technology-assisted contact tracing proposals, or for short, TACT. And the most prominent proposal has been a proposal by Google and Apple, their Bluetooth proposal. And while some TACT proposals may be more privacy-friendly than others, Every TACT proposal is predicated on the assumption that there will be widespread and equitable testing. And without these measures, TACT can actually be counterproductive and divert resources from proven measures. The third point is that privacy intrusions must be necessary and proportionate. Any program that collects personally identifiable data about people must be rooted in science and public health and be proportionate to the need. For example, we know that COVID-19 has a 2-week incubation period, so it would be disproportionate to collect the location histories of people for 10 years. It's more important than ever that everybody, including law enforcement, listen to what public health experts are saying about what needs to be done and what is effective and what isn't. It's equally important that any measure taken is narrowly tailored to protect civil liberties, privacy rights, and access to due process. Fourth, we should be wary of privacy invading companies that use COVID-19 as an opportunity to market their products, further legitimize surveillance infrastructures, and create future opportunities to make money. As we increasingly rely on technology to work, access education, connect with our loved ones, and even be on this call here tonight, we're likely exposing ourselves to more privacy harms. In the US, the government is openly working with Verily, a Google company, to offer online screening tests that require users to have a Google account. Sensitive health data are also being accessed by surveillance technology companies and mobile app developers. And as students increasingly learn from home, tech companies are rushing to provide free online learning tools, which of course should be appreciated because access to education is really important, but we should also be thinking about the privacy trade-offs that may come with using these products. And we should think about whether students, parents, and teachers really have a meaningful opportunity to consent to giving away their data. Lastly, we need an exit plan. We've learned from crises of the past that data surveillance tools we build to handle emergencies now often outlive the crises they intend to address. We saw after 9/11 the creation of very invasive surveillance programs, one of which was NYPD's program that lasted over a decade and used powerful ALPRs or automated license plate readers to religiously profile and spy on Muslims. The program was ultimately struck down as illegal, but that doesn't take away the harms that were already inflicted on this community. We want to make sure that any surveillance tool built for the purpose of fighting this pandemic will actually be terminated when this pandemic ends and will be repurposed for other means. So to recap, we can and must protect privacy during this public health crisis. 2, surveillance is not a panacea to stemming this pandemic. 3, any tool that is used must be rooted in science and must be necessary and proportionate. 4, we should be wary of self-interested and privacy-unfriendly companies. And lastly, we need to have a plan to terminate any surveillance tools built for this pandemic after it ends. At the ACLU of Washington, we're going to continue to monitor threats to privacy and civil liberties, and it's important that we all stay vigilant and not accept broadened surveillance infrastructures as a new normal long after this pandemic ends. So I'm going to conclude my remarks here, and I will turn it over to Michele.
Thank you so much, Jen, and really thank you, all of you. I hope those of you watching feel the same pride that I feel and my colleagues and the dedication they bring to the work and the hard work that they're doing. So I think I'm going to go back to beginning and go back to Breanne. And I have a number of questions for all of you. So I'm just going to try to pace myself, and then I'll check the box to see what's coming in from the audience as well. Breanne, you talked about tackling the issue of homelessness, both pre and post-COVID, on multiple fronts. And it'd be great if you maybe go a little deeper into what some of the work is that the ACLU is doing to accomplish that.
It helps if you unmute yourself. Absolutely. Thank you, Michele. In terms of, I kind of look at, and I think I said this earlier, the work in 2 buckets, although obviously there's a lot of overlap amongst both of those areas of work. And the first is in preventing homelessness in the first place. And I think we're really seeing how important that is. I mean, that's always been an important issue, but we're really seeing how I think there's a new sense of urgency in realizing how important that is right now. So a couple of the things that we've been doing here, and this is really at the lead of a lot of other organizations who've been doing this work for a very long time. And it's just been tremendous. And we've just been honored to get to, help support it. So one of the things that we've been doing is we signed on to a couple letters to the governor. And the first was with a number of other advocates. And I think that should be in the link. It's on our website as well. And it was asking for, basic public health and housing assistance for folks that are without shelter. And changing systems and shelter models to ensure that shelters and people that are working there, right, not just people experiencing homelessness, but that are working there have access to medical care, are able to practice social distancing, have proper testing and sanitation supplies and training, right? I mean, I think this is such an unprecedented time that we're, a lot of people, we don't know what we're supposed to be doing, what the proper policies and procedures and everything are. And the letter also asked for measures that keep people housed, right? Like financial assistance to people in danger of losing their homes, measures to mitigate harm to people who are living outside. And one of, the asks was redirecting efforts that are currently being used to enforce displacement of folks and redirecting those to making sure that instead of asking people to move or leave where they might be camping or keeping their RV or other sort of shelter, that we're instead trying to provide services and care. And we've seen a lot of actually really positive change in what's happening in Washington with regards to a lot of those measures. We're seeing shelters change how they're operating. We're seeing a recognition that housing a ton of people into one confined space, whether we're dealing with a pandemic or not, that there's a lot of reasons why that's not a model that works. We are seeing more, training and social distancing being practiced in the shelter space. And we're also seeing, along with the CDC guidelines that actually, we're seeing less displacement. So we're seeing fewer cities conducting sweeps of encampments. And a sweep is when is a term a lot of people know and a lot of people don't. So just for a little bit of context, it's when there are people that are camping outside and a government comes in and tells them they either have to move. Sometimes they arrest them. Sometimes they just threaten arrest. And often it results in the destruction of all of their home and all of their belongings. So we're definitely seeing, in response, I think, to a lot of advocacy that's happening, that being slowed down. And the second letter that we wrote, again, that we signed on to and led by a lot of really wonderful organizations, was about extending about keeping people in their current homes, right? So it was asking for kind of closing the loopholes on the governor's first eviction moratorium and making sure that we're just tightening protections and increasing protections for folks. And so we also saw a lot of movement there, and the most recent order that Governor Inslee put out expanded, protections for evictions basically to everyone. So you can't be evicted for anything except for a public health and safety reason, and that does not include COVID-19. So you can't be evicted just because you yourself are unhealthy or are dealing with the pandemic, but you actually have to be posing a significant public health risk. And it also resulted in the eviction moratorium be expanded to more non-traditional housing. So RVs, public property, where people have a dwelling. And it prohibited late fees and the threat of late fees. And there's also a temporary freeze on rent increases. So that was really great. With regards to kind of the other bucket of work, we continue to be monitoring what's happening to folks and the enforcement of stay-at-home shelters. We're really lucky in Washington, but not everywhere else is as lucky, that, we haven't seen like law enforcement go out and tell people they're not allowed to be in public space because they're poor, right? And so, we're glad, but we're keeping an eye on that. And we're continuing to keep an eye on how people that are unhoused, and particularly those that are unsheltered, that are living outside, are being treated by law enforcement and by municipalities, and making sure that they're able to stay where they're at. And not, having increased risk either because they're being forced to move and put into a shelter that's not safe, or because they're losing all their stuff, which is also increasing, their public health, risking their public health and safety. We have ongoing litigation on that matter as well. And we're also trying to work to pull together resources and update our website and share, to the extent that there are like new hygiene centers, or there are new places that people can go and access services. We're trying to keep aware of that and share that as well.
Thank you so much, Breanne. Really helpful. And we've got a pretty strong body of work in this area, as you can see. There's a question that came up, actually a couple of questions that came up for Kendrick about the youth advocacy work. And one of them is, you mentioned that we had made a request that students with disabilities continue to get their essential services. And someone wanted some clarity on what was the response to that. Has there been anything on that particular issue?
The simple and shortest answer is there was not a response, at least not a direct response to our letter. Having said that, that letter went up to the governor and his office. And so I don't think we were necessarily expecting
Shoot. Uh-oh. Are the other panelists able to hear me? Okay, great. So I think that Kendrick froze. So we're going to come back to him and in a minute. Sorry about that. That's one of the things about the virtual Flights and Rights program. Sometimes something goes a little bit wrong. So Kendrick will probably pop out and then pop back in. And so I'll take this, there he goes, he's gone. I'll probably take this opportunity to turn my attention to Jen and ask you to talk. One of the things that you said toward the end was something that I think about a lot, which is things get put into place to deal with a particular problem, in this case, a pandemic. And we want to make sure that those things don't continue to follow us into the future. So if it's directly tied to science and public health, okay, we get that. And we're not going to fight against those things, but how do we prevent those things from dogging us all the way into the future? So just what are some of the thoughts that you have about the exit plan idea?
Yeah, like I mentioned earlier, we do need to have an exit plan for any new surveillance technologies being deployed for the specific purpose of fighting the pandemic. And we need to be thinking about the buildup and expansion of surveillance infrastructure. What we know is that once the infrastructure is built, it can be really difficult to roll back. And what we want to avoid is overreaching surveillance becoming our new normal. We know that communities that have historically been targeted by surveillance, including racial and ethnic minorities, religious minorities, and members of different social groups, will be disproportionately impacted by an expanded surveillance infrastructure. In order for us to think about what we should be doing post-pandemic, we should also be thinking about what we need to do now to prepare. As many of you know, we have been pushing for strong surveillance oversight laws and strong data privacy laws in Washington. In Seattle, we're currently in the process of implementing the Seattle Surveillance Ordinance, which is a law requiring any surveillance technology being used by a government agency to undergo a public oversight process. We're also working on pushing for strong data privacy laws to give people rights over their data and keep companies accountable if they violate those rights. It's important that during this pandemic and after this pandemic, we keep pushing for such strong laws to keep governments and companies accountable to people. any exit plans that are created should be created with the civil liberties perspective in mind, and also built with public health professionals. So we should be listening to guidance on public health from public health professionals, in order to determine when is it appropriate to declare that a pandemic is over and we no longer need this tool.
Thank you, Jen. We are going to come back to Kendrick and give him a chance to answer the question that we only heard a little bit of. But before I do, Jen, I want to stay with you for just a moment, because we have a question about whether there are any definite plans to use cell phones for COVID-19 tracking, or is this still theoretical? And are we talking about state level, federal level? Is it already happening? Can you speak to that, please?
Sure. We've seen location tracking tools being used across the world and proposals being shared across the US. In Washington specifically, Governor Inslee recently announced a plan to deploy a 1,500 person contact tracing team, but this is in person, and is reportedly also considering technology-driven contact tracing systems, but nothing from what I've seen has been confirmed yet. But it's important to remember, before deploying any of these technology-assisted contact tracing systems, we have to recognize that these systems may not actually prove to be practical in real-world conditions, either because they're not accurate enough or because they're released in the absence of adequate testing and treatment measures. TACT systems will only be useful if those who learn about possible exposures to COVID can actually do something about it, whether it's getting tested, treated, or can implement measures like self-isolation. But it's useless if those services are unavailable or unaffordable. Any advice that encourages self-isolation won't work if the user of the TACT system can't actually afford to self-isolate. And so a TACT system deployed without equitable social and public health support systems may risk people's privacy without bringing equitable benefits. And to speak a little bit more specifically, the most prominent proposal we've seen so far is Apple and Google's Bluetooth contact tracing system. This system essentially works by you enrolling in the system via an app on your phone, and your phone shouting out a large string of random numbers every few minutes. And these strings of random numbers are then seen, quote unquote, seen by other phones enrolled in the system. Your device records the numbers your phone is shouting out, as well as the numbers other phones are shouting out. And if you're diagnosed with COVID-19, you would voluntarily upload the recent history of numbers your phone has shouted out to others to a central server. And if you haven't yet been infected, your phone regularly fetches the list of numbers that other people's phones have uploaded to the central server and compares them with the numbers your phone has heard from. And even if the system isn't perfect at identifying when two phones are in close contact, it would be more accurate than a lot of different location tracking systems that we've seen that are extremely privacy invasive and less accurate. Still, there are definitely a lot of civil liberties and public health risks that we should be thinking about. Just to name a few, as I said, every tech-assisted contact tracing proposal is predicated on the availability of widespread, affordable, and prompt testing. So this has to be available for this proposal to be effective. And additionally, we know that about 2.5 billion people will not have access to Apple and Google's Bluetooth system because either their phones are older and incompatible, or they just don't have phones at all. And many people who are poor or older fall into this category. And we know that people who are poor and older are also amongst those who are already disproportionately impacted by COVID-19. So while the Apple and Google Bluetooth proposal is pretty privacy friendly and compared to more privacy intrusive and less accurate location tracking tools, as our governor in our state and other public health officials and lawmakers make decisions about how, if and how to use technology-assisted contact tracing tools, they should be thinking about key principles of, whether the tool is truly voluntary, whether it's non-punitive, so it's not used for criminal or immigration enforcement, whether it's non-discriminatory, whether it's auditable, whether we can measure whether the system works, and if there is a an exit plan in place so that it doesn't outlive the crisis.
Thank you, Jen. One of the things that you said, and technology is always exciting, right? People want to use technology as a great tool. But I think the thing that you said that I just really want to highlight is about the testing, right? So one of the things that we have learned from public health folks is that really the way that we get a handle on this thing is through testing. And some of the countries that did widespread testing are the ones where there have been the fewest cases of the disease and the fewest deaths related to the coronavirus. So I'd love to see that investment in getting us to where we can actually do that testing and then provide the services for people who are most at risk, such as unhoused individuals and so forth, or put it into making folks comfortable and getting through the disease. Okay, I want to come back to Kendrick because we didn't get a chance to get all of your answer to that question. And then I just have, because of time, I think a final question that I want to ask of all of you. So Kendrick, it was about whether you had gotten a response to the issue of students with disabilities getting essential services. And there was also a related question about whether those kids currently or parents of kids with disabilities are getting any supports from either the school system or from other, private entities that you are aware of.
Sure. So the short answer is no. We did not get a response to our letter. We sent that letter up to the governor's office. I don't think we expected to hear from Governor Inslee himself. However, we were hoping to hear from someone. And last I understood, no one has received a response. But OSPI has been doing things, holding seminars, reaching out to parents. They posted frequently asked questions online. I think the problem is that the types of services that people are receiving is sort of much like our school system, where it tends to be school district by school district, right? Every school district has a budget. Every school district has a certain amount of resources. But generally, I think what we're seeing is a lack of services. Families who have children with special needs, who need services that can't happen over Zoom, are struggling. Speech therapy, occupational therapy, things of that nature aren't really able to be done over Zoom. It's certainly a hard shift for the youth themselves. And a lot of the folks who provide these services don't know how to do them, through online technology. So there are a lot of folks out there right now who aren't getting the supports they need. And I think the schools are trying to figure it out, but I think that there are some limitations to sort of what can be done when you can't actually physically go and see someone. And so trying to figure out ways where perhaps we can put two people in a similar space, even if they're not, right on top of each other, the 6 feet apart, is something that, we're hoping school districts are looking at. And so we've been encouraging, families to press their school systems and to continue to press OSPI for these things. In terms of supports for the family members themselves, again, there are supports in terms of OSPI has, provided platforms for folks to ask questions and be heard, but actually support for parents in terms of helping them be able to work at home with their own children, in many cases has just boiled down to here's a packet, here's this online program. Now, I have heard some encouraging stories, anecdotally from parents who have said, my therapist, my guidance counselor has called me and checks in on, my kid and checks in with me to make sure that I'm doing okay. But that's, again, sort of individual and they're individualized, and there's nothing sort of widespread for that. And that's really becoming concerning, and it's something that we need to get on top of before, these students start to fall too far behind.
Thank you, Kendrick. Super helpful. And I know the advocacy is going to continue. So we'll get what we need as best we can for the families who need it. So here's something for everyone. And you can each just have a shot at this, and then we'll have to close. One of the things that Breanne said right off the bat that is so true is that what happens in the time of this health pandemic which is unprecedented in our lifetimes, right? Like, this is not something we've seen before, but it is absolutely uncharted territory, and it's terrible. But one of the things that's happening is that it so clearly shows how in a time of a crisis like this, the inequities that already exist for people are exacerbated just by leaps and bounds. It really shows how much people of color, people who don't have money, they suffer so disproportionately. In light of that, what can we learn and take forward from this to try to build the better society, right? To try to say, okay, this has been pointed out in clear and absolutely certain terms, that we are letting segments of our society go without the freedoms and liberties that have been promised to all of us. What are some of the things we can do? And you can speak to your own area to leverage, I hate to use that phrase, something that is absolutely horrible and tragic, to turn it into something better for the future.
I think we have to refuse to go back to normal. It's very clear that normal was not working. Normal was not good enough. So, for instance, from my point of view, right, you look at what they're doing in the youth facilities, and you're looking at the amount of children they're releasing. You're looking at the crimes for which they're now saying, oh, it's okay, we don't have to actually take them into the facility because of COVID. And so if you don't have to take them into the facility because of COVID, you made this statement that you don't have to take them into the facility when COVID is over. So I think that the most important thing we can do is push to take these things that we've achieved through this crisis and make them the new norm. Going back to normal is not an option. It's not a world I want to go back to.
I hear you loud and clear. Jen, what about from your perspective?
I think we can learn from this pandemic that technology is not the solution to everything. Like I said earlier, without adequate testing and treatment, technology can be counterproductive, not only not helpful at all, but actually can harm the public health goals we're trying to achieve. And with that, we should not accept that technology is inevitable. We should question what technologies are being built for, with what values, who technologies are being built for. We know throughout history, surveillance technologies have always harmed historically marginalized people. We can see that in the history of the Lantern Laws, the history of Japanese incarceration, the spying of Muslims after 9/11, and so on and so forth. So as we're seeing the growth of a surveillance infrastructure in this pandemic, it's a really important reminder to take a step back and say, why is this happening? Does this need to happen? And how can we respond to demand more transparency and accountability?
Love that. Thank you, Jen. And Breanne, since you generated this question for me, you get to have the last word.
Ooh, all right. No. I would just echo what's been said before. I mean, like Kendrick, we can't go back to, whatever normal was before this. And I think what I find exciting about, I think what this pandemic has shown us, though, is what's possible, right? And it is possible to get people into housing. It is possible to be, increasing the types of services that we're providing for people. It is possible, to have, to support one another and have alternative places for people to go. It is possible to have a system where we're not punishing people because of their income or their poverty. And I hope that we remember, as things progress, like what brought us to where we are, and that we don't forget the lessons that we learned from this, including that, when people at the end of this and throughout this, right, it's going to be hard, and people are going to be suffering, and people are going to be harmed. And that we're remembering that this, like so many of the issues that we work on, are part of a system, and a system that we can definitely work, with and work against, but that it's not somebody's individual choice or behavior that's putting them in the situation that they're in, and that we should be, supporting one another and learning from that.
Thank you. Thank you, all of you. Yeah. Breanne, I lied. I actually get the last word. But, what I want to say is this. I'm so appreciative of all three of you and the advocacy you're doing. I'm grateful we have an ACLU because in a time of a pandemic, obviously, the first thing we want is for people to be safe and well and healthy. This is a devastating disease that causes great harm, loss of life, loss of livelihood, and I am not insensitive to that at all. I also recognize at the same time that for the ACLU, our role is to make sure that in the face of a pandemic, it does not become an opportunity for our civil liberties to be deeply encroached upon. It does not become a time where surveillance takes over or where we can ignore those who are most vulnerable in our society. We're here to fight for them and to step up for them. So really appreciate all the three of you, what you work. So thank you so much, Breanne, Kendrick, and Jennifer. Huge thank you to our audience. So grateful to you for watching, grateful to you for your questions, for your dedication, your solidarity, your capacity to care. We are in this together. We will get through this together, and onward we carry on. Thanks very much, and have a great evening, everyone.